The great thing about this approach to abdominal pain is that it takes a whole bunch of diagnoses and separates them out into categories that make sense. The first separation is between acute and chronic pain. The second separation is between diffuse abdominal pain and pain that can be localized. And the third way to discriminate between diagnoses is based on that location and the organ systems that are associated with it. And the final way to discriminate between diagnoses that are competing is to look at the characteristic symptoms associated with each of those diagnoses. Now, when we talk about acute abdominal pain that's urgent and diffuse, we have a couple of possibilities. One of them is bowel obstruction, and that comes with severe crampy abdominal pain and distension and vomiting. The other one is a AAA, or abdominal aortic aneurysm, and that's often characterized by severe pain that radiates through to the back. When we talk about acute abdominal pain that's both urgent and localized, we often talk about three possibilities. One of them is cholecystitis in the right upper quadrant, with pain that's more severe than your usual biliary colic, and sometimes referred to the right shoulder. In the right lower quadrant, we have the classic appendicitis, and classically it presents with periumbilical pain that then migrates down to the right lower quadrant. And then we have diverticulitis, which presents as severe and sometimes recurrent left lower quadrant pain. Now let's look at the category of acute abdominal pain, which is non-urgent and diffuse. In this category, we have two common presentations. One of them is constipation, characterized by a decreased frequency of stools, which are hard to pass. The other one is gastroenteritis, which is a common intestinal infection, characterized by crampy abdominal pain, nausea, and vomiting. So when we talk about acute abdominal pain, which is non-urgent but localized, we're often looking at three possibilities. One of them is in the epigastric area, and that's dyspepsia, with its characteristic burning regurgitation, sometimes made worse with food. The other is in the right upper quadrant, called biliary colic. That's that crampy pain that's sometimes made worse after a fatty meal. And the third one is a new one, and that's in the suprapubic area, a urinary tract infection, characterized by urgency, that's the need to go right away, dysuria, that's painful voiding, and frequency, that's increased frequency of voiding. Once you've decided that it's chronic abdominal pain, you have to decide whether it's diffuse or whether it's localized. Now, most chronic abdominal pain is diffuse, and most of the diffuse chronic abdominal pain is caused by irritable bowel syndrome. That's the syndrome that's characterized by change in frequency of stool and that has relief with defecation. The other cause of chronic abdominal pain to watch out for is inflammatory bowel disease. That's either Crohn's or ulcerative colitis. The common symptoms that go along with that are blood or mucus in the stool and chronic diarrhea. Now, chronic abdominal pain that's localized is either caused by one, right upper quadrant pain, biliary colic. That's the colicky pain that's sometimes worse after fatty meals. Or epigastric pain caused by dyspepsia. That's the kind of pain related to gastroesophageal reflux disease or peptic ulcer disease, often symptomatic by a burning pain that's worse with meals.